I'll invite Dr. Naren SHETTY. His topic is novel biomarker to predict anterior capsular fibrosis and possible therapeutic intervention. Dr.
Good, mo-
Naren SHETTY.
Good morning, everyone. First, I would like to thank AIOS and APAO for giving me this opportunity. I have no financial disclosures. Now, one of the key things for a successful surgery or to prevent complication is to have a perfect or a complete rhexis, or basically a CCC. But when you have anterior capsular fibrosis, it can be really challenging to complete the rhexis. You can have rhexis extension, PCRs, lens drops, and so on and so forth. So the research question was, can we actually predict which patients or which eye can develop anterior capsular fibrosis? So for this, we did a study where we tried to identify biomarkers in tears and aqueous, which contribute to the formation of anterior capsular fibrosis. This was the inclusion and exclusion criteria. Basically, we excluded pediatric cataracts. And we had a sample size of 100. 50 eyes were anterior capsular fibrosis, 50 eyes were normal anterior capsule. And regular cataract workup was done. AS anterior segment OCT was done. Tears was collected preoperatively, and also the aqueous was collected intraoperatively. Follow-up was done at day 1 and 1 month post-surgery. Now, if you look at the results, we found novel altered metabolites in fibrous capsule as compared to normal cases. And as you can see, there is a significant downregulation of antifibrotic factors, especially the most important being the harmaline. And the next question which came into our mind was, which these antifibrotic factors, which pathway does it really affect? So we identified it to be TGF-beta pathway. And the next question which came into our mind was, can we actually identify drugs which are already there in the market, which can act on the same pathway? So we did identify certain drugs which act on the same pathway, but the most interesting was the trehalose. Trehalose, as you know, I think all of us have been using in our clinics as a lubricant, and it's widely available and easily accessible to anybody who's practicing. So now we have identified novel biomarkers in anterior fibrotic capsules, but how do we use this in our clinics, which is more important? So the next time we see a cataract patient, we can collect the tears, put it in basically into this small compact diagnostic device called as Biopath Finder. Basically, it works on the principle of multiplex ELISA assay. And within 90 minutes, you will have a report in your hand. Now, if the patient has fibrotic capsule biomarkers present, then you can ask the patient, look, you have this high risk of developing it. Why don't you go for the surgery early? Now, if the patient is not willing for the surgery early, then you can tell, okay, look, you can put the trehalose eye drops till the time of surgery so you can prevent the anterior capsular fibrosis from occurring. That way, you prevent the complications that normally occurs in a fibrotic capsule, and also you make the surgery so much more safer and you deliver much better outcomes. So what was known was anterior capsule becomes fibrotic, and due to unidentified causes, fibrotic capsules can lead to difficulty and complications during cataract surgery. What our study adds is, for the first time, we have shown identified novel altered biomarkers, and also the key fibrotic pathways involved in it, like TGF-beta. And we have, with the help of these biomarkers, we are able to stratify the individuals at risk, and also we highlighted promising drugs like trehalose that could aid in preventing anterior capsular fibrosis. Thank you so much for your time.
So thank you. So few questions which come into my mind is, one is, could you demonstrate that trehalose really decreases the incidence of, finding one thing is that marker is okay, fine. But could you demonstrate that trehalose does decrease the incidence of progression of anticapsular fibrosis?
Yes, so what has been already established and published now, sir, is the trehalose works downregulates the TGF-beta pathway. That has been already published, sir.
Okay.
The whole point is, till now, the cause of the downregulation of antifibrotic factors wasn't discovered. So nobody knew what was that pathway that the fibrous capsule was occurring. So now we have identified these aspects. Since this has been already established, the next step is to see how we can actually prove it in patients that it actually doesn't occur when we identify these fibrotic capsules.
My only concern is, until unless you have some study,
Yes, sir.
let's suppose in 100 patients, 50 with the same group, 50 with other, and in one eye you start with Trehalose, in other eye you don't start with Trehalose.
Absolutely, sir.
And
It has to be
until-
done.
Yeah,
Has to
until
be
you have
done.
proved, you
Absolutely,
cannot
sir.
tell to the patients to start doing this. Number
No,
one
absolutely,
thing.
sir.
And second thing is, you told that you take out some amount of tears and then you see. So aqueous and tears are completely different. So how would you identify that the presence of this in tears would actually lead to anterior capsular phimosis or not?
Yeah, that's what, sir. So we did identify in this study,
Yes.
we have collected both, the
Yes.
tears and aqueous. This
Yes.
is just for the study purpose because we analyzed both the tears. So what we have shown is that from the tears itself, it being a non-invasive way of collecting, so that we don't need to do surgery and then identify, okay, this person had the risk. So then it'll be not much of use. So that is why we have tested the tears too in these patients.
The
so
question
that we can
is
do it, sir.
that the increase of this substance in 3 years versus the increase in aqueous humor, was it proportionally greater as compared to those
Tears,
patients?
normally biomarkers are much more larger, more pronounced, sir. It's more louder
As compared to
as compared
aqueous.
to the aqueous, yes, sir.
So, and malab, in both the groups, in groups which had anticapsular phimosis, the this beta whatever is there was more in the group
Fibrous capsule, sir.
fibrous
Yes,
capsule.
yes, sir. Yes, sir.
Okay.
Dr. Naren, actually, preoperatively, comparatively, we don't see that much of anterior capsular fibrosis, right? We are more concerned actually about capsular phimosis post-surgery. So did you follow up these cases who have some degree of anterior capsular fibrosis? Post-operatively, how do they behave? Are these, they are more prone to develop capsular phimosis? And did you correlate it with other findings, like say in pseudo-exfoliation and all, where you know that fibrosis
Right,
and phimosis occurs?
No, absolutely, sir. I think that is something that for this study we didn't look at, sir, because that wasn't part of the objective. But that is a very interesting point which we can look at.
Actually, see, the
sir.
post-op is something that we are more concerned about because
Absolutely.
pre-operatively, even if some degree of, unless of course, gross capsular fibrosis is a different story, but minor amounts of capsular fibrosis, even if they are there, not very difficult to manage. But it will be a very good thing if
Absolutely.
further
No,
studies can be
absolutely.
carried out and you can identify that a simple
Absolutely, sir.
drops,
Absolutely.
eye
And
drops
like you
can
said,
actually prevent that.
And like you said, sir, that if you have a higher, down-regulation of antifibrotic factors, and then you do surgery, they have a higher risk of post-operative,
So if you
if
can
they're not
prevent
developed.
that, they'll be better off
Absolutely,
post-op
sir.
also.
Absolutely,
So-
sir. Absolutely.
So
sir.
a good start. Let's see how things pan out. Thank
Thank
you so much.